CG Networks team for putting together this conference. I think we've had a warm welcome this morning, so thank you very much, and they're always there to help over the next few days. So I'm Louise Darling-Water, Network Chair, the English Network Chair. I'm happy to welcome you here to Vancouver. I hope maybe you've already had the opportunity to visit the city. We had a walking tour last night. If you have a few days after the conference, I really do recommend that you take the time to visit Vancouver, but also the province of British Columbia. And so for this 13th Health, Wellness and Society conference, we really are lucky to have it here in Vancouver. Now, perhaps on a less positive side, we can say that health inequalities, unfortunately, in Canada have been growing in recent years, and actually we can see that this is not a new thing. From the systematic discrimination after the Indian Act, we can see that there are forced displacement of the First Nations. They were forced into remote communities and reserves, and obviously suffering from access or lack of access to proper sanitation, economic and social inequalities. And this really forced increased poverty and health inequalities. And we can see also that, like in many developed nations, just moreover, the increase in poverty has increased health inequalities worldwide. On a positive note, what's quite remarkable about Canada is they do have a public healthcare system, and if we think about the huge scope of the nation and compare it to the US, this is quite remarkable. And I think we can also point to another positive point, and that's also the fact that there's been significant developments and advancements in precision health and advanced health technologies and services. And this is why we thought that it was appropriate here in Vancouver this year to have the conference talking about the key focus on digitalization of health services, digitalization of healthcare, not only in Canada, of course, but also from an international perspective. And we can see the scope for developments thanks to our first keynote, Robert Sindeler, who will be talking in just a few moments about how digital technologies in the pharmaceutical domain can empower patients. So patient-centered care is very important, and we can see that these developments and advancements in technologies in healthcare, where previously, before the pandemic, perhaps it was a little bit slow, we've seen great advancements in recent years, and this is obviously very important for patient-centered care. And we'll see later on today also other opportunities and advances in healthcare. But on the downside, there is also an exclusionary process. We know that vulnerable communities, those with disabilities, hearing impairments, etc., have difficulties coping with this rapid advancement in technology in the healthcare sector. So we have to also study how we can think of more inclusive processes as we advance with digitalization in healthcare. So those crucial downsides to the digitalization process will be really developed in the afternoon with our keynote, Ted Schrecker, who will perhaps be a little less upbeat about the digitalization process. And then tomorrow, Vitika Kira, who's our third keynote, will be talking about the digital divide in India. So obviously in developed nations, this is a significant problem to ensure that everyone is included in the digitalization process. But of course, we're not just going to be talking about the key focus. We still welcome papers more generally on the themes of health, wellness and society. So I think you can also enjoy listening to more general papers over the next 2 days. And finally, and this was a point that was made by Tamsin just earlier about the International Journal of Health, Wellness and Society, which is a peer review. Obviously, we invite papers on all scopes and from an interdisciplinary manner on health, wellness and society. But we also have started a couple of years ago, we started an innovation, and we decided that it would be good to have a special issue on the key focus and invite a guest editor to coordinate so that we can have this special issue. And so obviously next year, I will start the process just straight after the conference to invite you to submit your papers on the key focus for the special issue on digitalisation of healthcare. So on that note, I would also like to just say, please enjoy the next 2 days, and if you do get a chance to visit the city and beyond, I do